Permanent canines. In this lecture, I will discuss the characteristic features of canines as a class and also a description for permanent maxillary canine and mandibular canine. The canine teeth are 4 in number. Each canine is the third from the midline in each quadrant. Usually they are considered as the cornerstone of the dental arches due to the shape of the crown, their position in the corner of the mouth, and also the extra anchorage provided by their long, strongly developed roots. The maxillary and mandibular canine bear close resemblance to each other, with their crowns and roots are markedly convex in most surfaces, so in this aspect they are much similar to premolar than to incisor teeth. The function of maxillary and mandibular canines are also closely related. Usually the main function of these teeth is tearing. They tear food material during mastication. However, due to their position between incisors and premolars, and since they bear a close resemblance to the functional form of both premolars and incisors, they assist these teeth in their function of slicing, holding, and tearing food materials. As you can notice here, from the labial aspect, both maxillary and mandibular canine resemble a premolar with their single pointed cusp, while from proximal surface, both maxillary and mandibular canines bear a close resemblance with the functional form of incisor tooth. The characteristic features of permanent canines, or as we call it, class traits for the permanent canines. First, the canines, maxillary and mandibular, are considered the longest teeth in the dental arches. They are the longest and strongest teeth. Their single roots are longer than those of any other teeth in the mouth. Especially the root of the maxillary canine is considered the longest of all other teeth in the dental arches. Also, regarding the length of the crown, they have long crown cervico-incisal, especially the mandibular canine. Mandibular canine has the longest crown cervico-incisally, followed by maxillary central incisor, while maxillary canine is the third tooth regarding the length of the crown. Another characteristic feature is that the middle labial lobe is highly developed incisally into a strong, well-formed cusp. So we have a pointed cusp both for maxillary and mandibular canines due to the strong, well-developed middle labial lobe. Also, this development will provide an anatomical feature or landmark called labial ridge extending cervical line to cusp tip in the maxilla and in mandible. In addition, the distal slope of the cusp is usually longer than the mesial slope for both maxillary and mandibular canine, so the distal slope is longer than the mesial slope. Regarding the lingual aspect, anatomical landmarks from lingual view usually shows the lingual aspect shows a well-formed cingulum with marked marginal ridges and a lingual ridge. Especially this applies for maxillary canine. So we have a strong or large cingulum, well-developed marginal ridges. There is a lingual ridge extending from cusp tip to the cingulum, dividing the lingual fossa into mesial and distal fossae. For the mandibular canine, usually the anatomical landmarks on the lingual aspect are less developed. Finally, the canine, the presence of canine in the corner of the mouth with their long roots usually have cosmetic value due to the presence of what we call it the canine eminence. The canine eminence is the bony ridge that is located over the labial portion of the root. So this is the canine eminence for both maxillary and mandibular canines. So the presence of canine eminence help in providing support for the facial expressions, so it has a cosmetic value, can be added to other functions of canine. Finally, canines with our maxillary or mandibular are considered the most stable teeth in the mouth. This stability comes from several factors. So canine can be preserved throughout life, and usually they are the last teeth to be lost in the oral cavity. This comes from these features. First, they have a large labial-lingual dimension, as you can see here. They have long roots, well anchored in the alveolar bone. Also, the shape of the crown, the functional form, promotes self-cleanliness. So this self-cleansing quality, which is related to the functional form of canines, prevent food from collecting or accumulating over the surface of canine during mastication, so helps keeping these teeth clean even if the individual has bad oral hygiene. Now moving to the permanent maxillary canines. Usually the location of this tooth between or is considered as a transitional tooth from incisors or from anterior teeth to posterior teeth. So it seems to be a compromise in the change between these two types of or groups of teeth. So we can see that the functional form or the mesial half, this is the mesial, bear a close resemblance to an incisor and makes contact with the lateral incisor. While from the distal aspect or the distal half is usually similar to the outline of a premolar, and it will make contact with the first premolar. So this tooth is a compromise between anterior and posterior teeth. The characteristic features of permanent maxillary canines. First, they have a single pointed cusp with a thick incisional portion. We can see here that the incisional portion is thicker than that for the maxillary incisors. Also, when we view this tooth from a proximal aspect, the cusp tip is located labial to the long axis of the root. If we draw the long axis of the root, we can see that the cusp tip is labial to this line. Also characterized by a marked convex surface both labially and lingually, mesially and distally, with a bulky cingulum. The root is the longest, as was mentioned earlier, is the longest of all other teeth in the mouth. Also, the root is thick. Labial-lingually, it's narrow mesiodistally, however, it's thick labial-lingually. With developmental depressions, these developmental depressions will help anchor the tooth in the alveolar bone and adds further stability to this tooth. Regarding description of various aspects, first we'll discuss the labial aspect of maxillary canine. The geometric outline is a trapezoidal or pentagonal outline. As you can see, the outline of the crown resembles a five-sided figure or shape or a pentagon. So the outline is roughly trapezoidal or pentagonal. Dimensions of root and crown. The characteristic of canine in which the canine resemble premolars in this feature is that the cervix or the mesiodistal dimension at cervix is 2 millimeter narrower than the mesiodistal dimension across the greatest curvature or across contact area. The difference is 2 millimeter. Also, the root, as mentioned earlier, is the longest, while the length of the crown is the third longest in the dental arches. The position of contact areas. The mesial contact area is located at the junction between the incisal and middle third, while the distal contact area is located in the middle of the crown or the middle of the middle third. The outlines, as can we notice here, are convex, the outlines mesial and distal. The cusp tip is usually located in line with the long axis of the root. So we can notice that the cusp tip is located on the long axis of the root, with the mesial cusp slope shorter than the distal cusp slope. Regarding surface anatomy, the main features is the presence of well-developed middle labial lobe, which result in the formation of the labial ridge. This is the labial ridge extending in a curved manner. It's curved mesially, extend from the cervical line to the cusp tip. On mesial and distal aspects of the labial ridge, we have depressions, small depressions, represent the mesial and distal developmental lobe. Moving to the lingual aspect, the maxillary canine is characterized by a large prominent cingulum. It's considered the most prominent cingulum among all anterior teeth. Well-developed mesial, this is the mesial, and this is the distal marginal ridges. Also, we have a lingual ridge, well developed, extending from cusp tip to the cingulum, dividing the lingual fossa into two mesial and distal lingual fossae. So this is the mesial and this is the distal fossa. Also, the root, as we forgot to mention in the labial aspect, the root is narrow mesiodistally and usually have a curvature in its apical end, mainly toward the distal. Moving to the mesial aspect, the main characteristic features for maxillary canine from this aspect: first, the geometric outline is wedge-shaped, just like the incisors. So it's triangular or wedge with the base near the cervix and the apex of the triangle at the cusp tip. Usually the crest of curvatures, both labially and lingually, are also located in the cervical third, just like all other anterior teeth, but they are more incisally located compared to maxillary incisors. This is due to the presence of well-developed middle labial lobe and lingual lobe. As you can see here, the cingulum is prominent and large. Also, the outlines, labial and lingual, are more curved and convex compared to the maxillary incisors. This tooth is also characterized from this aspect by a wide facial-lingual dimension of the crown and roots. Usually, the canine is considered the widest anterior tooth facial-lingually. It is the facial-lingual dimension is 1 millimeter greater than that for the maxillary central, whether across the crest of curvature or across the cervix. Finally, the cusp tip is located, as mentioned earlier, labial to the long axis of the root or the tooth. Also, the canine characterized by presence of developmental depression, which is relatively shallow on the mesial aspect. The presence of developmental depression helps to anchor the long root in the alveolar bone and prevent rotation and displacement. From the distal aspect, the main differences is first, less curvature of the cervical line. Usually the curvature is 1 millimeter less. The distal marginal ridge is heavier and more irregular compared with the mesial marginal ridge, and the developmental depression is more pronounced on the distal aspect than it is on the mesial aspect. Finally, the incisal aspect of maxillary canine is characterized by the following. The geometric outline is diamond shape, as you can notice here. Not triangular like the maxillary incisor, it's diamond. The crown is asymmetrical, as it's obvious. The mesial half is more curved. The distal half seems to be stretched out to make contact with the premolar. The labiolingual dimension is always greater than the mesiodistal dimension. So the labiolingual is greater than mesiodistal. This was mentioned earlier. Finally, another characteristic feature is that the extension of cusp ridges and mesial and distal contact areas usually form a straight line across the incisal aspect of the tooth. This will differentiate the maxillary canine from the mandibular canine, where the extension of these landmarks usually is not straight but with a lingual inclination. Finally, we have developmental anomalies. Usually these anomalies are common for the maxillary canines. First, maxillary canines are the most commonly impacted teeth after the third molars. As it's noticed in this radiograph, the maxillary left canine is impacted. Impaction is the failure of the tooth to erupt into the oral cavity beyond its eruption time. Usually there are some mechanical obstruction for the eruption of the tooth. And the fact that the maxillary canine erupts later into the oral cavity, usually after the maxillary premolars, increases the chance of impaction of this tooth. Another anomaly is the ectopic eruption. Usually the canine can erupt in an abnormal labial or palatal position. And in this case, the patient will need orthodontic treatment to solve this problem. Finally, we can see a transposition of the maxillary canine. Usually, transposition can be found between or can mainly be seen with the maxillary first premolar. Transposition can be defined as the interchange in the position of two permanent teeth located in the same quadrant. Now moving to the permanent mandibular canine. The identifying features of the permanent mandibular canine. First, the mandibular canine is narrower mesiodistally and labiolingually than maxillary canine. As is evident from this figure, the mandibular canine is narrower mesiodistally and labiolingually compared to the maxillary canine. The overall length of the canine, that's to say the length of the crown and root, is similar to that of the maxillary canine. However, the crown is 1 millimeter longer, while the root is 1 millimeter shorter compared to the maxillary canine. So maxillary canine has the longest root, while mandibular canine has the longest crown in the oral cavity. Other identifying features for permanent mandibular canine are the lingual surface of the crown is smoother compared with that of the maxillary canine. Usually the cingulum is less developed, the bulkiness is less for the cingulum and marginal ridges and lingual ridge. Also, the cusp of the mandibular canine is not well developed as that of the maxillary canine. The cusp ridges are thinner labiolingually, and the incisional part is not bulky and thick as the maxillary canine. Also, the cusp tip is located either on the long axis of the root or lingual to the long axis of the root, rather than labial as the case with the maxillary canine. This arrangement, of course, will help normal inclination and articulation between the maxillary and mandibular teeth. Regarding the labial aspect, usually the mandibular canine, as mentioned earlier, is narrower and longer. The crown of the mandibular canine is narrower and longer than that of maxillary canine. The geometric outline is also pentagonal, just like the maxillary canine. The location of contact area is usually more incisally located. The mesial contact area is usually located near the mesio-incisal angle. So this is the mesial contact area. While the distal contact area is usually more cervically located than the mesial, but however it is still more incisally located compared with that of the maxillary canine. The cusp tip is also located in line with the long axis of the root, just like the maxillary canine. The mesial slope is also shorter than the distal slope. Regarding surface anatomy, we have a labial ridge extending from the cusp tip to this is the labial ridge extending from cusp tip to the cervical line. However, it's less prominent than that of the maxillary canine. Regarding root length, it is 1 millimeter shorter than that of maxillary canine, and also it can show either a mesial or distal. As you can see here in this figure, this tooth shows a mesial inclination of the root, while in this case we have a distal inclination. So it's the only anterior tooth which may have a mesial inclination rather than a distal inclination of the root. Regarding the lingual aspect, the outlines are similar. However, the lingual anatomy is different from that of maxillary canine in that the cingulum is smaller, less prominent. The mesial and distal marginal ridges are not well developed. The lingual ridge is also not well developed. It's mainly raised near the cusp tip. The lingual fossae are shallow. So, in general, the lingual aspect is usually flatter, smoother, and more regular than maxillary canine. And in this respect, it resembles the lingual aspect of mandibular incisors more than it resembling the lingual aspect of maxillary canine. Moving to the proximal aspects, the mesial and distal aspects. This is the mesial aspect. Usually, the outlines, labial and lingual outlines are less curved than those of maxillary canine. The crest of curvatures are also located in the cervical third of the tooth. The cingulum is less prominent. The incisal portion is also thinner labiolingually than that of maxillary canine. The tip of the cusp is located lingual, just like the incisors, mandibular incisors, and sometimes it's located in center with the long axis of the root. The developmental depression, however, are more pronounced on the mesial aspect than those on the mesial aspect of the maxillary. For the distal aspect, the main differences are less curvature of the cervical line. So we have less curvature in the distal compared to the mesial. Also, the developmental depression is usually more pronounced on the distal aspect than mesial aspect. Finally, the incisal aspect of the mandibular canine. Just like the maxillary canine, it also diamond shape. It has a diamond shape, and the labiolingual dimension is greater than the mesiodistal dimension. However, the mesial, this is the mesial outline is less curved compared to the maxillary canine. In addition, the mesial and distal cusp ridges, along with the extension of mesial and distal contact areas, usually forming a line that's inclined lingually. This is different from that of the maxillary canine, where the extension of cusp ridges and mesial and distal contact areas usually form a straight line across the incisal aspect mesiodistal line. Finally, regarding the anatomic variation, the mandibular canine is the most commonly anterior tooth to be found with a bifurcation of the root. It can be seen with a labial and lingual roots. In addition, it may show a long root or extremely short root.